I shall try to explain this subject of treating psychosomatic disorders from a little different angle. Dr. Palmer, our founder, taught that there are only three causes of disease: poisons, trauma, and autosuggestion. Now, what did he mean by the word poison? It seems as if he meant that anything that got in the body or on the body that was detrimental to that body, he classified it as a poison to the body. Let's take, for instance, the weed known as poison ivy. A boy will be walking through the woods, and all of a sudden he brushes up against a poison ivy plant, and later he breaks out with a skin rash that comes from the toxic material in the poison ivy, to which he seems to be allergic. Now that is a thing, T-H-I-N-G, that made his body abnormal. Another example is that of a little girl who eats too many beans for her digestive tract. Now that's a thing, beans. She's eaten too many, so she becomes ill. Those beans, in too great a quantity, became a poison to her body. So now let's take the case of a person who likes alcohol, and he drinks too much. Suppose he drinks a whole quart of whiskey each day. That alcohol, being a thing, T-H-I-N-G, makes him deathly ill. Then consider the little child who gets into his mother's medicine cabinet and finds a bottle of pills. It doesn't make any difference what kind of pills they are. They may be just aspirin. But if that child takes too many of those pills, then the aspirin becomes a poison to his body. The child is then ill from a thing, T-H-I-N-G, a thing that got into the body from the outside and which was detrimental to the body. So you see, what we call organic disease is anything, any physical thing that gets in the body or on the body which is too much for the body to handle. It becomes a poison to that body. Now, that is one cause of disease. They call it organic. It affects the organs of the body. The skin, of course, is an organ. You know what is meant by the organs. Now, Dr. Palmer says that whenever this poisonous material gets in the body or on the body, there is a concussion of forces that acts upon the muscles, which, in turn, being attached to the vertebra, may pull one or more of these vertebrae out of position, cutting off the normal transmission of nerve energy. This will result in a disorder. The subluxation would not be the cause of that disorder, but the thing that caused the subluxation would be the cause. Now, it's very necessary for a person to understand those three causes of disease. Very necessary. It takes some study. We have thousands upon thousands of diseases, and there are some diseases now that are caused by certain things from the outside of the body that get on the body. Now, I could list many of them, but there's poison plants. That's from the outside. There's poison food. There's insects and bugs, of all kinds. There's rattlesnake bite that's from the outside, put the poison into your body. And you could just sit and think that there must be 400 or 500 things that live on the outside of the body that would make the body ill if it came into contact with them. Then we have certain things that get in the body that would cause the body to become ill. So if you can get into your mind that the word poison, as used by our founder, meant that anything that was detrimental to health that got on or in the body was listed under that general term poison. Now the next cause is traumatic conditions. It means something that harms the body. And I will list a few of them, but there's many things that will harm the body, which would come under the general term of accident. Whenever there's a terrible cold spell and the chill in the air or the dampness in the air is such that it is too much for the body, then that would be under the word traumatic. And all accidents of any kind or character that harm the body would be under the form of traumatic. Now these two causes, first, poison, and second, trauma, needs special treatment. And every kind of doctor has a method by which he treats these conditions. The chiropractor, he uses the restoration of the energy in the nervous system to overcome these conditions, whereas the medical doctor always tries to give some chemical in the body or on the body that will alleviate the trouble. So now you've got poison and you have trauma. And we want you to understand that the suggestive therapy course that we teach is not for the poisonous material or the traumatic. It's for those patients who have deliberately made themselves ill by wrong reasoning, wrong habits, and wrong thought. They call it in medicine psychosomatic, meaning that the psychic, which is the mind and the soul, is out of tune with the body. The body is called somo, psychosomatic. We were talking about the first cause of disease, which was poisons. Now we come to the second cause, which Dr. Palmer called trauma. Consider the case of a little boy who is normal in all of his musculature. But he gets the big idea that he wants to be a baseball player, and he aspires to be the pitcher on the team. So he goes out with his friend, begins to pitch baseball. He throws that ball with such force that he abuses the muscles of his right arm. He overworks them. He has gone beyond their capacity, and as a result, he has a very sore arm. Now, what caused his arm to be sore? It was the abuse of those muscles that caused the condition. Now, this is called a traumatic condition. Another case, a woman is in perfect health. She is walking down a flight of stairs. she slips, loses her balance, and falls down the stairs. There is a concussion of forces of this outside force, which is the stairs coming into rude contact with the inside force, which is the normal musculature. The outside force is too strong for the inside force to compensate, so we have a concussion of forces, which results in the muscles pulling out her sacroiliac joint. This is called a sacroiliac slip. There she has a structural condition which may be corrected by chiropractic or by medical treatment. The medical doctors have their method of correcting this condition by the use of a brace and also by the use of ultrasound treatments and heat. There are many cases where people abuse the structure of their body. For instance, consider the case of a man who's constantly employed lifting 100-pound sacks of cement from a truck to the ground. There comes a time when the weight of this cement overtaxes the ability of his muscles to compensate, and he begins to suffer from a condition known as pain in the back. This has come about by the misuse of his reasoning. He has been lifting too heavy a load for his muscles. I could cite hundreds of cases, but let us say that the body will stand just so much strain that is put upon it from things of the outside. And whenever too great a strain is placed on the body, there is a concussion of forces. The muscles begin to contract. They pull out a bone, impinge a nerve, and you have trouble. The cause of that bone being out is the misuse of the body. The chiropractor would adjust the bone back to normal. The medical doctor would prescribe something to relax the tissue so that the bone would slip back into its place without an adjustment. Of course, you know that the body is involved in accidents which cause subluxations. Say, for instance, you were riding along in the front seat of your car, and another car would ram your car from the rear with such force that your neck is thrust backward. You would have a condition known as wry neck. That is an accident. Any kind of an accident, like falling off a ladder or getting a piece of glass embedded in your arm, all come under Dr. Palmer's listing as traumatic disease, traumatic conditions. The third cause of disease, and the most important, is what Dr. Palmer called autosuggestion. It's claimed by so-called authorities that fully 80% of all the disease that doctors are called upon to treat are not organic, not traumatic, but psychological or psychosomatic. That means mind over matter. Now, the real value of concept therapy and suggestive therapy training is to teach the doctor how to handle these conditions that come under that heading, psychosomatic. Most of the people who come to the chiropractor, they suffer from some self-caused disease, which comes about from autosuggestion. To illustrate how suggestion works, let us imagine 5 people sitting in a room watching a television. Somebody in authority, some medical man, is on the program describing the symptoms of a certain disease. He describes the symptoms so vividly and with such emphasis that somebody in that audience is apt to accept that talk as a suggestion. The person who receives that suggestion begins to dwell upon it, analyze his own feelings in regard to it, and comes to the conclusion that he may have or is going to get that disease. He anticipates it, expects the symptoms to get worse, and he creates into his inner mind, by autosuggestion, the picture of that disease. When the innate mind receives an image like that, providing it's logical, it will then proceed to produce it in the flesh or in the environment. Now that's the way that hypnosis works. In hypnosis, the operator will still the conscious mind of this subject. Then he puts in a suggestion that goes directly into the innate mind, and then it is produced by that organism. So autosuggestion is the third cause of disease listed by our founder. The authorities claim that fully 80% of all disease comes from this one source, autosuggestion. Consider now the hole-in-one adjusting technique. If the patient who has trouble goes to a chiropractor who practices the hole-in-one, and the doctor has great faith in it, he is convinced that when he restores the axis or the atlas back to normal, that it'll bring health in the body. If that is his basic concept, and he has perfect faith, this means that the innate mind of that doctor would throw out that vibration to the innate mind of the patient. And if the innate mind was affected by the suggestion, it would then try to produce the image in the patient's body. Now, no doubt that's the reason for the success of those doctors who practice the hole-in-one. We find that the majority of their patients must have been suffering from psychosomatic disorder. Now, this is true of basic technique. It's also true of the Merrick technique. It's true of all other adjusting techniques. If the doctor has perfect and implicit faith in a technique, this enables his innate mind to throw out the proper vibration, which will come to rest in the innate mind of the patient, and the innate mind will express the condition in the patient's body. The same principle is involved in using the remote control unit that you use to operate your television set. The vibration goes out from that little unit directly to that instrument, and it is to produce a certain effect which you have controlled with that unit. Now, if the doctor who's treating his patient with one of these techniques has in his own innate mind a complete faith that when he does whatever the method implies, it will produce a certain result in that person's body, then his innate mind is throwing out that vibration which is picked up by the patient's innate mind, and the manifestation takes place. Now, that is true of most of the chiropractic techniques. For the treatment of a purely organic disease, Dr. Palmer said that you will always find a subluxation. What did he say you should do? He says, locate that subluxation, adjust it, and leave it alone. And that is exactly what we are to do for these traumatic conditions. Locate the subluxation, adjust it. But in the diseases and disorders that fall into the category of psychosomatic, you have to do something more than adjusting that bone. You have to change the vibration. You have to change the concept that's in the subconscious mind of the patient, which is being expressed in the body. Now that's where the techniques have made their successes and their failures. It gives you the secret of how to use these various things to your advantage. Now, I'd like to tell you another little story. True story. When I was attending chiropractic college, we were learning to palpate, and we had what we called the pit class. The students would all be seated in the class facing the platform. The instructor would require one of the students to give the demonstration of palpating the spine when the patient was seated with his or her back to the audience. The student was required to run his fingers up and down the spine of the patient and call off to the instructor the subluxations that he found to exist. A little old lady who had come in to the free clinic was to be examined at this pit class. I happened to be the one who was selected to palpate this lady's spine in front of all those students, and I was to call out or identify whatever vertebra was involved and which I thought should be adjusted. So the little old lady put on her kimono so that her back would be left bare. There she was, sitting there with her back towards the audience. I stood beside her with the instructor who was ready to write down the names of the vertebra that I found or thought to be subluxated. So, very carefully, I put the palm of my left hand on the little old lady's forehead, tilted her head down on my hand, and I began to gently stroke the vertebra, first on one side and then on the other. Finally, I came to the conclusion that the first bone in the neck there, the atlas, was PRS, which means I found that it was posterior, right, and superior, and the instructor would write that down. Then I'd move my hand down on the dorsal region of her back, and I'd begin to stroke one side, then the other, from the first dorsal to the 12th. I would keep stroking, trying to make up my mind which vertebra was out of alignment. After a few minutes, I would say, third dorsal, LI, means left and inferior. Then I would stroke down the spine some more, perhaps another minute or so, and would say 12th dorsal, RS, which meant that it was right and superior. And the instructor would write all this down. Then I would get down to the lumbar region of her spine and begin to stroke, first on one side and then on the other. Finally, I would make up my mind which one of these vertebrae I thought needed attention. Now, after about 7 minutes of that stroking, I was through, so I said to the little lady, as I released her forehead, I said, "Now." She said, "Oh, doctor, that was the finest treatment I have ever had in my life. All my pains are gone. I have never had such a perfect feeling in my back before. I want you to know, doctor, you are a genius. You have performed a miracle here." Well, I looked at her in amazement. I thought to myself, my goodness, I haven't even adjusted her. But she said she's all right. So I said to her, well, lady, I find that you're okay now. I don't think you're going to have any more pain. But if any of your pain should come back, you come back over here and I'll give you another treatment just like this one. And with that, I escorted her to the door and out of the classroom. Well, the instructor jumped on me and he said, why, you didn't even adjust that woman. And I answered, my goodness, why should I adjust her? She got over her pain. But my instructor penalized me with 4 extra hours of study because I had not gone through with the adjustment. Now, what happened in this case? The answer is this. When her conscious mind told her that here was a fellow who obviously knew his business, she had the concept that her troubles were being eliminated. And when I completed the process of stroking her spine, she thought that was the treatment. And that concept became activated and manifested itself in her body. And as a result, she had no more pain. You see, that's the same way that these technique works in psychosomatic conditions. When I was out in Los Angeles many years ago, I happened to go down to a little town called Ingleside. I went into an old chiropractor's office to try to get the doctor interested in the machine that I was selling. He had a little kneeling table where his patients would kneel down and he would adjust them. I noticed that he had no dressing rooms. All he had was a desk and that little old kneeling table. He had quite a few patients waiting out in his reception room. He'd take each patient into his office, have him or her kneel down, fully clothed, and he would adjust them quickly and out they would go. When I finally got to talk to him, I found he wasn't interested in any technique or any machine. But I became interested in what he did. For he had a large practice, and his patients were getting well. And I asked, Doctor, just what do you do? I notice you don't even have any dressing rooms. He answered, all I do, Fleet, is to let them tell me all of their symptoms and discuss all of their problems. Then I tell them that I'll give them an adjustment each day, and they'll get better and finally get well. Each time I adjust a patient, I have him or her kneel down there on that table, and then I turn his head to the north, always to the north, and I adjust his axis, PR. Then I ask, what else do you do? And he said, that's all. Then I ask, do you adjust everybody the same way? Yep. Everybody gets the same adjustment. Then I said, my goodness, man, what do you call yourself? Do you call yourself a chiropractor? If that is all that you do, how many of your patients get well? And his response was, well, I get more of them well than the other fellows who use all these fancy techniques. I turn their head to the north and adjust their axis, PR. And I asked, why to the north? He answered, that's the way the energy runs. It runs from south to north. If I turn his or her head to the south, I don't get any results. I turn their head to the north and give all my patients the same adjustment. But I get as many people well as anybody else in this town. And apparently he did. So I wondered, what happens in these cases?
But I don't wonder anymore. That old boy had faith in his conscious mind. He had impressed his innate mind that then when he'd adjust their axis, the innate mind of that patient would bring about the result. There you had a perfect combination, and you had perfect results. He cured them. Now, I could tell you many instances where it would seem that in psychosomatic disorders, anything can cause anything, and anything can cure anything, as long as you're dealing with a self-inflicted disease. I remember back in the days of my early youth, my grandmother made me wear a bag of acidity around my neck, tucked inside my little shirt. Each winter I had to wear this acidity when I went to school. It was to keep me from catching cold or from catching any of the childhood disease. I had perfect faith that it would do just that because my grandmother told me so. And all the other children attending my class were required by their mothers or grandmothers to do the same thing. So all the kids in my class wore that bag of acidity. You see, it kept us from catching cold, chicken pox, mumps, measles, and so forth. And we'd get into that classroom where there was a big pot-bellied stove. And when it got real hot, the odor of that acidity would penetrate the air, and it smelled to high heaven in there. As a result of wearing that acidity, we did not have those early diseases. We just could not catch a disease as long as we wore the acidity. That was the concept in our inner mind. Now, here's another story. My grandfather was suffering from rheumatism. A slick salesman came to see him one day, and he said, "Mr. Fleet, you have rheumatism? Well, I have something here that'll cure it. It's a buckeye. This buckeye came from Borneo, and it has a magnetic power in it that absorbs rheumatic pain. If you buy one and wear it in your right-hand trouser pocket, you won't have this rheumatic condition in your legs." The salesman was very convincing. The old man was sold. He believed that sales talk, and he bought one of those precious buckeyes. It cost him $5.98. With complete faith, he put that buckeye in his right-hand pants pocket, and as a result, he did not have any more rheumatic pains. Now, I was a very young boy, and the idea occurred to me that if I would steal Grandpa's buckeye and then remind him that he didn't have it in his pocket, he'd get those rheumatic pains. And then I'd tell him that I would find that buckeye if he'd give me a dime. So I stole it out of his pocket one night, hid it in a secret place in the front room. About 3 o'clock that afternoon, I said, "Grandpa, let me see your buckeye." He inquired, "What do you want to see my buckeye for?" I said, "I just want to see it, Grandpa." So he reached in his pocket, and lo and behold, the buckeye was not there. Within an hour, the old man experienced all of his rheumatic pains. And then I told him that he'd give me a dime, I'd find that buckeye. Well, he gladly agreed to that. So after a little while and a little hunt, I found the buckeye, gave it to him, and he gave me a dime. Now, that's the way I got my spending money when I was a kid. Now, you may think these stories are silly, but they are true. They show how the concept in the subconscious mind will produce these psychosomatic disorders. which authorities claim constitute 80% of all the disease that doctors deal with. Now, you might go to your veterinarian and say to him, we find in our symptomatology book that the human being is subject to over 1,600 various diseases. How many diseases is the animal subjected to? And he will probably say about 52 diseases. If you should ask the veterinarian, do you have any animals who have whooping cough? He'd say, no. Do any of these animals have mumps? No. Do any of these animals have high blood pressure? No. Now, you will find that the animal who cannot think inwardly cannot create disease concepts. So he's free from the majority of the diseases that we humans have. And then you'll begin to find out that the great majority of patients who are coming to you in the future will suffer not from organic disease. There are very few people who put something on their body or in their body that makes them ill.